Okay, ladies, can we talk? Did you know testosterone is very important to a woman's sex drive? Here to talk more about that is Dr. Angela DeRosa, and she is with DeRosa Medical Group. Thank you so much for joining us.
Oh, it's awesome to be here. Anytime I have an opportunity to tell women they have a lot of testosterone, I'm all for it.
Yes, well, sometimes, though, a woman gets to a point where she has a low sex drive and doesn't realize that it might be attributed to not enough testosterone.
Right. It either could be that or your boyfriend or partner forgot to get you something for Valentine's, even you told them that you didn't want anything. So guys, don't ever believe that. But no, certainly when you look at sex drive, women are actually very complicated, which is no surprise to anybody. There can be privacy issues where you have grandma living next door to you or kids trying to break into the bedroom.
Distractions.
So distractions, stress. Women really need that stress relief in order to have desire. But when you deal with all those things, what really drives desire in women is in the brain, and it's testosterone. So it's not about anything down here. It's all up here is where the sexuality starts in women. And testosterone is Mother Nature's key to libido and desire in women.
So how does a woman know if maybe she's losing some of that testosterone? Is there a certain symptom?
There's, well, certainly low libido, low desire. So I hear all the time, well, I love my husband, but I'm not in love with him. That's a clue that certainly there may be a chemical issue going in the brain, because women equate that in-love feeling with their spouse and sexuality. And testosterone deficiency can give you that feeling when everything else is going pretty good in the relationship. Also, we start to see irritability, anxiety, panic attacks in women that are very new to them, fatigue and apathy. You just don't feel motivated to do anything anymore. The other sign that we often don't think about is the midsection weight gain, where it can be working out, eating right, we're craving sugars, but all of a sudden we see the weight shift from our hips where they belong to the middle, and that's usually a testosterone deficiency symptom.
And that's when you're working out, you seem to be doing everything right, but nothing's working as far as it going away. And that happens to men too when they're low with their testosterone. So, okay, if a woman decides that she needs to go get it checked out, how do you do that? Is it blood work?
Well, it's a combination of things. First, you need to be seeing a provider that really understands the role of testosterone in women, because there's still a misperception, even amongst medical professionals, that women don't make a lot of testosterone. The other thing is the lab reference range that picks up testosterone deficiency may not always be accurate for women. You really need to listen to their symptoms and look at blood work, but make sure you're going to someone who really understands hormones, because primary care in general gets very little education on hormonal medicine, in particular testosterone in women. So look at the symptoms, get an exam, make sure that there's nothing else causing it, because there can be certainly other things, and then really looking at your blood work.
So once you've done that, you decide, okay, I'm low with testosterone, we need to get it obviously back in. How do you do that? And I know some women are probably at home thinking, wow, is that going to get me facial hair, and you know, do I have to worry about my voice dropping? What are the concerns?
When you're doing it right, it's not going to cause major problems. The goal is not to give us super levels. So we're not targeting to give you a testosterone level of men. That would be ridiculous. We'd be full-blown hairy Sasquatch man, and that's not what we're looking for.
No, we're not.
Women actually make a lot of testosterone normally, so you may have to pluck a chin hair extra once a month or twice a month. That's not that big of a deal, and I always tell my patients, if I gave you $1 million house but you had to mow the lawn once a month, would you want the $1 million house?
I think we'd probably
I think you probably would. So testosterone replacement's not that difficult for women. We have multiple options. We can put it under the tongue in what's called a troche or troche, depending on how you say it, target. You can also have creams, or what we specialize in, which give you very steady states over 4 months, are what are called pellets. And those little pellets look like Tic Tacs, which we insert under the skin right here in a very minor procedure. They last 4 months. So there's multiple ways to handle this.
Is that the same protocol that a man would go through if he was low on testosterone? Because I know a lot of men are getting the shots now.
Absolutely. So men have a few more options available to them because there's more FDA approved. Actually, women have 0 FDA approved testosterone products, so we have to compound everything for them. But men have more options, but they're all very good. We just have to find the right one for the right individual, because not everything's going to work best for some people.
And is this protocol long term, or as you said with the pellets, 4 months?
Well, the pellets last 4 months, but we put them in 3 times a year. But how I tell women about hormones, as long as you want to feel good, this is not just about treating symptoms, it's about longevity and health, because testosterone helps with glucose metabolism to help that midsection weight gain, helps prevent prediabetes and diabetes and coronary artery disease. So this is about maintaining health. So I always say hormones till the day I die.
Wow, that is something else. And you know, I love that we were talking about earlier, a lot of women obviously don't associate this with themselves, but you get into it like a gym, for example, and you find men and women struggling with that same midsection sort of frustration. They get to a certain age. It is very similar, right? And they go hand in hand.
Absolutely. Men and women, the symptoms are almost identical for both men and women. Men just have a little delay. They tend to have it around 50s and 60s, where women are 30s and 40s, because they have much more testosterone to begin with. Also, women, our symptoms, we tend to blame it on stress and various other things, but you're absolutely right. Weight is essential, and maintaining that midsection health is about testosterone deficiency, and you can do all the right things, eat good meals, work out all the time, and still struggle with that. And it's not you, it's your body working against you. Mother Nature can be not very nice.
Thanks to you, now we're more informed. We appreciate it. Always good to see you.
Likewise, thank you.
When we come back, since we were talking about working out, we're going to learn how to savvy stretch before you work out.